periodontal surgery. Periodontal surgery two type. هناك periodontal surgery for treatment وأكو periodontal surgery for aesthetic reason. periodontal surgery for treatment اللي احنا قلنا we have two major periodontal disease اللي هي gingivitis و periodontitis. periodontal surgery for treatment in this two major disease to eliminate of the pocket. In gingivitis يكون false pocket فنرفع by gingivectomy. In the periodontitis we need to eliminate of true pockets by open and see. We do flap and open the periodontal region or region affected by periodontitis, then do open root planing. Then any surgical procedure used to treat periodontitis or modify the shape of periodontium. Surgical treatment always after cause-related therapy, after evaluation. The first phase, remove all the retention factor, remove all calculus, overhang filling, sharp bridge, any retention factor, do scaling and root planing for the effective area in periodontitis and in true pocket and loss of attachment. So we have to eliminate the false pocket in gingivectomy. We do scaling and root planing. If there is edematous, there is a shrinkage. If it's fibrotic pocket, we do surgical removal by gingivectomy. In periodontitis, also conservative treatment approach. In slight periodontitis, good oral hygiene, scaling and root planing. When there is moderate to severe periodontitis, we do root planing. If we need papilla preservation, cellular incision flap to insist to the pocket and eliminate the pocket. In moderate to severe periodontitis, we do more surgical treatment indicated. The most important thing in periodontal surgery, there is a critical zone, soft tissue, tooth surface, underlining bone, attached gingiva. All of this point, it's important we put in our consider before do any periodontal surgery. Also, we have a general principle in periodontal surgery. We should careful planning to this surgery. We know the etiology, the aim of this surgery, and the prognosis of this surgery. Principle very important. By prepare the patient, sedation, anesthesia, scaling root planing. If the patient have systemic disease, if we have any bleeding, all this principle we must take in our consideration before treatment of periodontal surgery. Patient preparation, قلنا re-evaluation after phase 1. We check if root planing, good root planing, remove all irritant factor, smooth root surface. If root planing is failure, we can't reach the base of the pocket, then we can open and see. We do preparation before any surgical treatment. We must prepare everything after we go to the surgery, measuring to prevent transmission of infection, prepare the patient to the surgical procedure. We protect ourselves by sterilized gloves, mask, eye glass, everything to protect ourselves. Also, prepare the patient if he need any sedation. We must give him local anesthesia before any surgical treatment. Anesthesia if he have allergic to any type of drug. We must be careful before give him any prescription. Tissue management, if the type of tissue, thin tissue, we call it phenotype of the tissue, or thick tissue, attached, how many attached gingiva, effective of treatment. We must do any surgery with sharp instrument, a quick operation, don't delay in the time, sterilized operation, so we can do our treatment. Surgical instrument, very important. We have many type of surgical instrument. This surgical instrument different between gingivectomy and the flap. In gingivectomy, we have three main instruments: Kirkland knife, Black's knife, and Orbit knife, which we call it surgical instrument for gingivectomy, or a knife for gingivectomy, اللي هي Kirkland knife, Black's knife, and Orbit. This is a Kirkland knife. The shape of Kirkland knife تكون يعني ذات نهاية تشبه المثلث، وتكون حادة، وتحتاج إلى sharpening من فترة إلى أخرى، sterilization, re-sterilized many times. Another type اللي هي Black's knife، هذه تتغير، نشيل البليد ونخلي بمكانها بليد آخر ونشدها، وتستعمل تشبه الكريكلاند نايف أيضا for gingivectomy. الأوربن اللي تكون النهاية مالتها sharp تستخدم interdentally. This is Kirkland knife and this is Orban knife for interdental treatment in gingivectomy. This is surgical for flap operation. Okay, when we do any surgery, we have many type of flap. Horizontal incision, we can do horizontal incision with bevel, external bevel incision in gingivectomy. 45 degree apical to apical point to get rid from false pocket, forced pocket, and suprabony pocket. We have inter-bevel incision, internal bevel incision, second incision. This is incision done in a flap operation, periodontal operation. This is second incision, interclavicular incision, interclavicular incision. Then remove the pathological أو نسميها inflamed collar. we do 3 incision, beveled incision, interclavicular incision and horizontal incision to remove the inflamed column. Vertical incision present in some of surgical treatment. This vertical incision in apical repositioning flap أو coronal repositioning flap ممكن نستخدمه. To elevate the flap نستخدم periosteum elevator. We have 2 type of flap, full thickness flap and partial thickness flap. نبقي البريوستيوم ما نرفعه completely. gingival surgical technique. احنا قلنا الجنجيفايتس هي inflammation of soft tissue، ما عندي loss of attachment، ما عندي bone resorption supra bony pocket. إذن أسوي الكاتنج إن bevel incision، أشيل الكاتنج. قبل كان أكو نسموها gingival curettage، إنه ننظف السلكس الموجود to get rid of inflammation قبل ما نسوي السيرجري. احنا نسويها مرات نسوي scaling and deep scaling حتى نخلص من الانفلاميشن إلى أن يصير شرنكج. إذا بقى عندي fibrous tissue deformity بالجنجيفة أسوي جنجيفكتومي حتى أتخلص من الفولس باكت. Curate also very important procedure to get rid of debris inside the pocket, and we do by curate, gingival curate, by curate to get rid from the debris in the pocket. Many type of procedure. We can do it excisional new attachment procedure. We can do it by laser. This is also technique to subgingival performed with a knife and with a laser. Ultrasonic curate by ultrasonic or Cavitron. The most important surgery, gingivectomy. الجنجيفكتومي remove the pocket wall. قلنا اللي هو يكون false pocket ما عندي loss of attachment مع عبر cemento enamel junction. البروسيجر تصير by insertion of the probe أو pocket measuring tweezer. نحدد البيز of the pocket sometime 3 4 5 whatever the pocket depth يكون على شكل scallop appearance. base of the pocket تكون scallop appearance نحددها by periodontal pocket أو marketing pocket. حددنا البيز of the pocket. الكاتنج مالتنا تكون 45 degree apical to apical point حتى نتخلص من الفولس pocket كلتها. بهذه الطريقة أحدد البوكت، أسوي scallop appearance by bleeding point. البليدنج point قلنا تصير apical to apical point. أشيلها by Kirkland knife. أنظف interdentally by Orban. أخلي باك after 1 week. أشيل الباك وأقارن before و after. periodontal flap قلنا to get access حتى أشوف يعني open and see. أفتح أشيل السوفت تيشو حتى أشوف البوكيت، وأبدي أسوي ديبرايتمنت وروت بلانينج بالبوكيت. من أهم أنواع الفلاب اللي إحنا عندنا بالبريودنتال هي الموديفايد وودمان فلاب. الموديفايد وودمان فلاب أهم أنواعها، وقلنا تعتمد الفلاب عندنا على الانسجن، تعتمد على هي full thickness أو partial thickness، نشيل البريوستيوم أو لا. بس الموديفايد وودمان فلاب هي البروسيجر المعتمدة بال بريو. عندنا الأوريجينال وودمان فلاب يختلف عن الموديفايد وودمان فلاب. الأوريجينال وودمان فلاب بvertical incision ويرفع كليته، بس لقوا انه هذا الفيرتيكال انسجن انه مو مفيد بالنسبة لنا. اذا اخلي راح يصير excessive exposure to the bone ويصير وراه bone resorption. فموديفايد وودمان فلاب رفعوا هالفيرتيكال انسجن، رفعوا لغو وبلش يفتح وودمان فلاب بثري انسجن اللي هي قلنا 3 incision of woodman flap اللي هي تكون horizontal و interradicular and horizontal interradicular و parallel to the long axis of the tooth حتى get rid from هذه الانفلامد كولا ويتخلص من عندها، ويبدي يسوي روت بلانينج وينظف المنطقة.